Hey, Serenia.
Well, hello. I'm kind of nervous. I'm sweating. But I don't feel anything, so that's good.
Well, you got all this milk on your lips, isn't it?
You got
Do
milk.
you remember the commercial, You Got Milk? That's how you look like right now. All right, are you ready?
Yes.
Okay, are you numb yet?
Totally.
Yeah? Do you
Your
feel-
tongue.
Yeah, probably like tastes funny. All right, let me get all the numbing cream off you. Some alcohol. By the way, Dr. Tal, hey there. We're doing a little bit of a lip augmentation on one of my doctors in the office. So first time?
First time.
First time.
Oh.
All right.
Virgin.
I was gonna
Virgin
say that.
lips. All right, let's clean all the Got Milk commercial off here. Let me clean it one more time.
How many people are there?
Oh, it's got a lot joined in.
All right, very good. All right. So as you can see, she's got nice lips. Maybe a slight asymmetry, but overall, very nice lips. All we're gonna try and do here is just get a little bit of more fullness.
Let's see those lips. Let's see those lips before. Okay.
Alright.
With the numbing cream, I feel them so huge.
It's always, you think they're really big because of the numbing.
Yeah.
Mhm.
Alright, so I use Allergan products. Juvederm is 3 different kinds, or 4 actually: Ultra, Ultra Plus, Velour, and Voluma. Right now we're doing an Ultra Plus. Alright, ready for injection. You ready, Serena?
Mm-hmm.
Gonna start from the side, go towards the center. Okay, now let me have a good look at your lips again. We took a picture before. Not bad. Maybe very slightly less full on the left lower lip. Otherwise, pretty symmetric. Alright. You ready?
Mm-hmm.
Okay, just breathe in and out slowly and relax. Alright, little pinch. Breathe in and out slowly. Alright, little pressure. You're doing it right. Excellent. Any pain at all? Alright, so we do pretty good on the numbing here.
Mhm.
Nothing.
So, plus gentle hand,
That's right.
slow. Patients are very comfortable. And just make sure that low pressure so it doesn't bleed much. Great. Okay, we're gonna continue. In the pinch, breathe in and out. Excellent. All right. Great. Still no pain? Okay. Good. Alright. Alright, dear. Put a little bit more right there. Little pinch. Breathe. It's close to the center. It's a little more sensitive. Perfect. All right.
Michelle bleed more than I do,
Yeah,
right?
she
She
was like,
told me to a vampire.
you're like a vampire. You're not supposed to take aspirin or Advil or leave, and try not to drink any alcoholic
Alcohol.
beverages before you come to get injected. Adult drinks.
Grown up juice.
All right. So we're doing great here. A little pressure here, so you just spoke too soon. Now you're bleeding. All right. All right. How's the pain level?
0.
0. Good. So if you can come from this view straight on, you can see in a second that there's a little, very minor, very natural enhancement to that. Close your mouth, sorry. Stubborn little spot here. Hold it for a second. Okay. Okay. Very, very slight, minor, very natural enhancement. Okay. Now, this is going to be a little sensitive here. Okay. So ready? Here we go. 1, 2, 3. Pinch. There we go. Okay, so as you can see, no pain. If you do it right, and you prepare the patient for the lip injection properly, it should not really hurt much. Okay, we're gonna move to the other side, same kind of deal. Alright.
Says
Just breathe in
Buck
and out
Winter.
slowly.
You'll tell Brittany and I send love.
Right back at you. So again, gentle. Very nice. Just breathe here. Great.
Very good patient.
I can see that. I can see that. Alright. Now, some patients have very thin lips. And so when you have very thin lips, it's more challenging. Because to try and fill the lips when they're very thin is more difficult. And sometimes in order to get fuller, voluptuous lips, you have to do a few treatments about 3 months apart. So you'd start not very aggressive, you just try and kind of fill the lip so the skin tends to stretch a little bit and accommodate the filler. And you come back in about 3 months again and you can put more filler then. And even third time sometimes if needed. Depending on what the patient requires or needs or wants. Very good. And obviously you always want to check for symmetry, make sure that you're not overfilling one side compared to the other, a little massage. After the treatment, I tell my patients to ice their lips first 24 hours. No massage is necessary unless they feel something like a boil or lump, which is not common, but it can happen. And then another little pinch. Breathe. Tends to swell about 5 days on average, and then that's when you usually see the results. Some people it swells a little longer, some people less. We do have a great arnica here in the office, so the patients can start using that a day or two before. There's also kind of the arnica lipstick, if you want to call that. If you have a bruise, that helps heal it up quicker.
Exercise? Can I do exercises?
The day of, I tell patients to try and avoid any exercise. If you really need to, you can, but I think it just increases a little bit of the swelling in the body overall. So.
Yeah,
And I can kiss, and I can kiss.
Yeah. Do you really need to today? You must.
Not really. Not
It'll
really.
be a little bit better tomorrow because it's going to be even fuller tomorrow.
Exactly.
So there's some comments, you know, as far as pain is concerned, and they were asking, does it hurt? Katerina had answered, it doesn't hurt. The working out, like you had mentioned, no working out.
What other questions? So pain, you can see. I mean, she doesn't even flinch. You know, some people are a little bit more sensitive. So if someone is very sensitive to pain, they may feel some discomfort. But we do try, and we have a special numbing cream that we apply. I tell the patients to come an hour before. And we keep it on for 45 minutes, and then we ice it. So when you do that, it definitely reduces the pain significantly. Some people use there's a machine out there, I forgot what it's called now, that vibrates. That works on the gate theory. Pretty much if you stimulate somewhere else in your body, your brain disconnects from the discomfort that you feel here. I sometimes will put a finger and kind of vibrate myself or pinch, so the patient's brain is perceiving. But honestly, I mean, the way we do it, I barely ever need to do that because the patients are very comfortable, you can see.
And
the area that's the most sensitive is in the center. Okay,
and they wanted to know again what filler it is again that you're using.
Okay, so there's different ones for, what did they say, different strokes for different folks. It depends what you want. You know, I use all different fillers. Really, I think the FDA approved this one, which is the Ultra Plus for the lips. But if you use off-label, you can use Velour. I've used Voluma, and you know, those are a little more aggressive.
This is Juvederm.
This is Juvederm Ultra Plus. There's a price difference, there's longevity, there's the cohesivity or the stickiness of the material. It kind of change. That looks beautiful. So come in the front here again so they can see once I get this off. 1 second, because there's a little bleeding.
Doing a great job. Beautiful.
Thank you.
Yeah.
Oh, the lips. I'm beautiful.
Both. I don't know about me, but
your lips are so gorgeous.
I've had my times. That's why I got you ladies in here. Make me look good. You can say hi, Tanya. Flip it over to your face.
No, I'm good.
You're good?
The photographer will flip over later, yeah.
Okay, so there you go.
Let me see.
I don't feel a thing, but
You're numb as could be, right?
yeah.
Okay, let's clean up here.